Is cough CPR useful? Cardiopulmonary resuscitation or CPR is done to maintain breathing and circulation in cardiac arrest. Usual CPR needs another person to do chest compression and artificial respiration for the cardiac arrest victim who is unconscious. Coughing increases intrathoracic pressure and squeezes some blood out of the heart into the aorta. Theoretically, one can remain conscious if one continues to cough during a cardiac arrest. Practically, it seldom works as the loss of consciousness in cardiac arrest is very fast, so that the individual seldom recognizes cardiac arrest at the onset.